Here we're going to be targeting the lower back, starting with the SI joint. So we're using a pair of therapy balls in the toe, starting at the base of the spine where the spine meets the hips, and just nestling the balls in against your back, against the wall. And you can add a little movement here, pinning the balls where they are, and then tucking and tilting your hips or shimmying a little bit side to side. Feel free to readjust the balls as needed. If you bring them up a little bit higher to your lower back, you can bend your knees and roll up and down, getting the balls to roll along your erectors along the sides of your spine. Any spot you want to pause and add a little bit of a hip tilt or tuck, that's going to create a little bit of a pin and stretch for the muscles of the low back, which feels awesome. So go ahead and spend as long as you need there, shimmying, adjusting, playing with the balls, and breathing. When you're ready, we're going to target the QL muscle, which is deeper to those spinal erectors that you can feel. So you've got to come at it with about a 45-degree angle with pressure coming in from the side. So we're targeting the muscle just below those erectors, trying to come in from the side until you feel that kind of tender, deep ache. You'll know it when you get there. Yep, and when you're on it, it feels like a hurt so good kind of sensation, especially if you struggle with low back pain. Make sure you do both sides. Again, we're targeting from a 45-degree angle, pressing into the balls against the wall to those deep QL muscles below the erectors, coming in from the side. And we're just going to sink in and let the balls do their thing as they sink in, using pressure from the wall, sinking into that low back. Finally, we'll finish with a stretch, stretching that QL, that lower back on one side. The weight's on your back foot here as you cross the front leg over and reach up and away to stretch the whole side body for a couple of breaths. Then we'll switch weights on the back leg, front leg crosses over, pushing your hip over to the side as you reach overhead.